Good afternoon, everyone. I'm Evan Hanger, co-chair of the Senate HHR Finance Subcommittee. I'd like to call the meeting to order and welcome all of our members here. It is a very busy afternoon for everyone, and so our committee is, most of our members have to be in several places at one time, but we do have a quorum established here, and we do have, I believe, about 10 bills that have been referred to us that we want to hear a little bit of testimony on, make recommendations on for the full committee, which will be then acted upon by the full committee tomorrow. We've also been very busy receiving information, lots of input on the budget amendments, the governor's proposed budget, as well as member amendments. And I think everyone has been busy contacting the membership and staff relative to the priorities that they see in the HHR budget. So we're always in HHR revenue constrained. In other words, there are always more places to spend the scarce dollars than we have the capacity to address. But we do our best every year to try to address high priorities, and so we will be doing that again this year because and the members, this is kind of scary to think, but we've got to wrap this budget up for a recommendation by get it out next Sunday afternoon. So we're going to be busy this week, particularly at nights after the other work has been done. Any member here now that has anything to make comments about before we move forward? All right, hearing none, we'll just basically go down the docket here. I see. Who do we have queued up first? I see a couple members here, but we can. Senator Mason, were you first? Come ahead. You've got a couple bills here. Yes, thank you, Mr. Chairman. And we'll take them in order you prefer.
If we could take Senate Bill 1313 first, sir. I believe that this is an ongoing work in progress.
Right.
So there is a substitute.
Right, okay. Is there a motion that we recommend the substitute? No. Second? Motion properly supported. And just as a refresher for all of us, we heard extensive testimony, and you presented this bill last week. There were some issues technical amendments, I think, that are embodied in the substitute that we have in front of us. There was also somewhat of a conflict in terms of direction and policy in the near and long term between your bill and Senator Sutherland's bill. So do you want to address that just briefly?
Yes, sir, Mr. Chairman. Since we last met, the changes that are worthy of bringing to your attention are on line 15. We talked about licensing in making sure we only pay licensed in-state private day, as well as if they're out of state, they would have to be licensed by the equivalent out-of-state agency. A lot of the other changes that we made remain the same. We do define transitional services a bit more. And then the bulk of the changes, Mr. Chairman, are in the final clause where we're talking about setting up the work group. And, Mr. Chairman, that's really the difference. Mm-hmm. Senator Sutherland looks to use money this year for services that CSA does not traditionally fund. This work group is designed to, decide, do we move it to DOE? And if we do, that's one question. But do we use CSA monies for things that have not traditionally been used? We call out very clearly transitioning services. That's our effort to get children that have been in private day back to the educational system. There was some controversy over us saying that that's for a 12-month period, because that's a new step for us, using that CSA money for transition. In the updated that we worked on this weekend, we directly address on line 175, the work group shall specifically evaluate whether or not Children's Services Act funding should be expanded to include ongoing support for students with disabilities following the 12-month transition period. So while that's not a part of what we're doing now, that is very specifically called out as an effort to one of the groups to directly address some of their thoughts on the topic. We kept the makeup of the work group fairly generic, Mr. Chairman, because as we started calling out individual groups, there were 10, 12 groups that we could call out. So this list is not exhaustive, as we've said from the beginning, but with the most important emphasis, Mr. Chairman, being on line 158. Prioritize for students with the most severe disabilities who are at risk of being placed in an out-of-school placement. On line 163 to 65, we talk about looking at the different models of special education, private education, specialty regional schools, and in-state delivery. So that's an effort for us to look at schools that are providing it in-house today, schools that want to bring it back in-house, and regionals, kind of like more rural areas who are unable to do it individually but have pooled together and are working for regional models. So, finally, Mr. Chairman, we ask for a first report by November of this year, knowing this is going to be quite an undertaking, but with a final report of November of 22.
Okay.
So this has been an ongoing effort, Mr. Chairman. It's our best of doing it without fiscal impact, but looking at the bulk recommendations 1, 2, 3, 5, and 7 in the JLARC report, probably the most encompassing of that. And as I said, Mr. Chairman, we've continued to work with as many parties. I cannot thank Mr. Tweedy, Ms. Wallmeyer, Mr. May, our incredible staff has been with us every step of the way helping us, and so that's Bill.
Right, thank you, sir.
Thank you, sir.
Any member have any questions at this point? If not, do we have people signed up to speak to this? We don't. Okay.
Been a lot of speaking, Mr. Chairman.
We've had, and I'm sure we've had lots of conversation about this previously, including the buildup around the JLARC report. We have, I guess, in some instances, delayed facing this head on for some time, and so I believe we've got the bill in order. Members have questions? Is there a motion? Motion properly supported to recommend reporting the bill, that is Senate Bill 1313, dealing with the Children's Services Act. And we're talking about the committee substitute that has been drafted. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Okay. I believe that was you out there, Senator Vogel?
That was me.
Okay, very good. Thank you. All right. Any opposed? All right, our recommendation, the unanimous recommendation would be to report this bill tomorrow.
Thank you, Mr.
And
Chairman.
you have one more?
Mr. Chairman, I do have Senate Bill 1462. This is our effort to provide, we talk about access to broadband and affordability. This was an effort to set up a pilot for the next few years that focuses on our ability to provide affordability. What we have done, I asked for a $150,000 budget amendment. But, Mr. Chairman, we just got a fiscal impact statement today, and I really don't know what to make of it, quite frankly. The thought process was take $150,000. We could pilot. We're trying to be the differential. We're using SNAP households, so they're identified households in our social services system. The federal government will pay $9.25 for internet. We would supplement it with $5.75. So I put in a budget amendment for $150,000, saying that if we did 1,000 households, it'd be $68,000, 2,000 households, about $139,000, and then 10% of the money is going to social services to stand up the program. All right, the fiscal impact statement that we just got this afternoon speaks more of rather just standing up the program in year one to see if we can get it structured to find its way into the next budget. This speaks to actually setting up an administrative program and a computer system. So this tends to be, with this fiscal impact statement, is much more extensive than we envisioned. When I talked to the Commissioner of Social Services, he did say that once we set it up and come up with a new program and a new computer system and new administrative functions that would, in fact, take money to set that up, as well as probably FTE. But we had tried to figure a way that we could begin the pilot in this next fiscal year with the $150,000 to see if we can start reaching some households capped at 1,000 or 2,000 because we just don't have enough money for it, and just see what it entails so that, as I said, with the goal of coming back next year with money in the budget, asking for the $350,000 program, asking for the 2 additional FTE, and focusing in on any lessons learned that we had done with this kind of stripped down pilot to see if we could get the plane up in the air, Mr. Chairman.
Okay. The Any members have any questions?
It sounds like a great program. I just want to try and get the understanding of the $5 million versus the other amount. Do we know how much of it was cost to set up the program versus the funding for the families?
Well, Mr. Chairman and Senator Eben, the $5 million is, you'll see that the pilot is anticipated going through 2024. So the $5 million would be if, in fact, we get it funded in the future, if we set it up, stand it up, and can make it work. In the next 6 months, the federal government is providing a $50 a month stipend for internet. So this wouldn't even come into effect because that would cover. This would be when they revert back to the $925, and social services would work with the SNAP households that we know, up to 377,000 of them, but just trying to find 1,000, 2,000 that we could set up the program and pay the differential, which is $5.75 a month.
Okay, Mr.
So
Chairman?
the $5 million would be anticipating no more than that in the whole pilot process.
I'd like to move to report. Is that the appropriate motion, or do we have to put the clause on it?
We would need the clause, and there may be further. Mike, the 5 million figure, what was that inclusive of?
Well, Mr. Chairman, the 5 million figure is actually just a cap that's in the bill, so I think it's somewhat dependent on how much the General Assembly would decide to appropriate. I think really the issue is the cost to kind of get it started. Like Senator Mason said, I think he envisioned a kind of a smaller cost to get it started. The fiscal impact statement's a little bit higher. The commissioner of DSS actually is on the Zoom if you want to ask him any questions.
Okay. Did y'all have questions, or was your question more about, it would need the clause?
Well, I would move that we add the clause and report.
Okay, is there a second?
I'll second that.
Okay, motion probably supported. All those in favor of amending to add the financial contingency clause signify by saying aye.
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 Mr. Chair, is,
Mr. Chairman?
Yes, Lisa?
Yeah, I'm sorry. Can I just ask, when y'all are making motions, if you speak into your mic? I'm having a hard time hearing
Sure.
what actions.
The
I'm
motion
needing
was,
to
the
talk
motion
for
was
you.
to add the clause from Eben, and it was
Thank you.
seconded by Deeds.
Okay, and that was probably my fault. I turned away so I could see who I was talking to. The configuration
Mr.
is,
Chair, I would just ask of Senator Mason, is this an administration bill that the Department of Social Services supports this idea?
Mr. Chairman, Senator Deeds, this was an idea that came out of the internet group, but it is not a formal administration bill. I did reach out to the commissioner to see if, in fact, he felt like we could move this program along through his program. He testified positively in the first hearing, but I'll let him speak for himself if he's, but it is not an official administrative position, Senator Deeds.
okay. Are you on the line, Mr. Commissioner?
I am, Mr. Chairman. Thank you very much. If I may, Mr. Chairman?
Yes, if you could go ahead and respond a little bit here.
Sure. Yep. We do not have an official position on this bill, so we have a no position. The fiscal impact, just to speak to that so everyone understands, we can implement this program regardless of how much money is appropriated to it within that 10% cap that is included in the legislation. What we are trying to illustrate in the fiscal impact is if we have a modest amount of money to get started like we do for this year, then we can still live within the cap of 10%. If much more money gets appropriated and we stand up a much larger, more robust program, we can live within the cap, but we'll have to, start hiring some staff and doing some systems work. But we can absolutely live within the 10% administrative cap and stand up the program just as Senator Mason articulated in his testimony. Thank you. Happy to answer any questions.
Okay. Are there questions directly for Director of Social Services? This is a bill that I actually hadn't focused on previously in terms of the specifics of it. When we're discussing this, are we talking about offsetting costs incurred for someone that already has service to pay for their monthly tab rather than creating access?
Mr. Chairman, it could be worked that way, but it's designed to reach out to households that do not have it, help them draw down their federal stipend, and then augment the money. So it's designed to increase access with the $15 rate that some providers offer, but the $9.25 that comes from the federal government isn't enough. I think that made me going up to $10 after the $50 runs out, but now it's $9.25. So this was an effort to augment the $5.75 for new households, so access and affordability, Mr. Chairman.
Okay, all right. Senator Evan, did you, you were ready to,
Yeah, I'd like to move to a report,
okay. Motion properly supported?
seconded by McClellan.
Okay. Motion properly supported to recommend reporting the bill with the clause on it. And it's one of those things where we'll have to be sorting out priorities as we allocate funding resources. So all those in favor then signify by saying aye. Aye. Any opposed? Okay, we will recommend reporting that with the clause.
Understood.
Thank
Thank
you,
you, Mr.
Senator
Chairman. I
Mason.
thank you and the committee.
Okay, do we have, let me just go back to the top of the list, or is there? Senator Lewis?
Yes, sir. Mr. 1362 I have.
1362.
1362.
Yes, sir, Mr. Chairman, members of the subcommittee. 1362 is a reporting bill, and has a relatively modest fiscal impact. But the genesis of the bill was obviously my district, particularly where I live in my district, was at ground zero for the early stages of the pandemic. As you all will recall, we had a couple of our poultry houses over there were just run through like wildfire. And so there was a lot of public disinformation, no information, hysteria. And so what this bill seeks to do is hopefully allay some of that. I will point out that when it became apparent the extent of the problem in both of these poultry houses, they implemented measures that really slowed down the spread. And in the second wave that we had, several weeks ago, the poultry houses were not on fire as they had been before. So those measures did work. So they were pretty responsible about it. But the point is of the bill, Mr. Chairman, is to get information out to the public. And we've worked with the stakeholders in this and have adopted some language to put some guardrails in here. I can't say that they're all in support of it, but we did adopt a lot of the language that they suggested to make it a little more palatable. Specifically, the committee adopted a substitute, which is the second paragraph, which goes on to define, first of all, the bill was amended to go for employers from 30 employees to 50 or more employees. And it goes on to say it defines a worksite cluster, which is now 5. At one iteration had 3, but it's supposed to be 5 cases with illness onset and within a certain period of time, a likely epidemiological linkage. And so you can see in the substitute exactly what the bill does. And so that, Mr. Chairman, is the bill. Of course, the Department of Labor came out with regs, which are now permanent, which requires reporting to the health department. And I think that's a much lower threshold than just requires report, but there's no obligation to get that information out to the public. And so that's what this is concerned about, Mr. Chairman.
Okay. And it does appear to have a fiscal impact. I haven't gotten into the nuts and bolts of how they came up with that figure, 96,000.
I think it may be an employee, Mr. Chairman. I can't recall either. Right.
They need to add an employee?
Mr. Chairman, it's a contract employee.
Okay, Mike, thanks.
To
Mr. Chair,
Senator McClellan?
not to complicate things, but being a lawyer, so is this intended to only apply to private employers or?
To what, I'm sorry?
Private employers?
I think that was the original intention, although I don't know that the language necessarily narrows it down that way.
Yeah, Mr. Chair, I would just note that because it's a Section 1 bill and because the bill does not define employers. I do think it's a bit vague as to whether it would include this Commonwealth or localities, or I don't know if the patron wants to think about some language.
Your thoughts that we ought to define it in a broader sense, or?
I mean, I want to make sure that the patron's intent is clear and that anyone that sees, because Section 1 bills are different than those that are in the code, I want to be sure that anyone who, employers know whether it applies to them or not, and employers can include the Commonwealth, it can include local governments, it can, so.
Mr. Chairman?
Yes, Lisa?
I would say, just to follow up what Senator McClellan has said, usually in the code, we're within the context of a chapter or an article that goes ahead and defines what employer means. So I think to ensure that we capture Senator Lewis's intent as well as the committee's intent, a definition would probably be recommended.
Mm-hmm.
Perhaps, Mr. Chairman, perhaps on line 8, it could say private and public employers, or you want a more formal definition?
Well, Mr. Chair, let me ask the patron a question. Senator Lewis, is it your intention that this would apply to anyone who is subject to the Department of Labor's standards?
That was the original intention, Senator McClellan.
Okay, so I think what we'd want to do is, I don't know if those regs define employer or Lisa, I don't know, maybe you can help me out, but I think we need to clarify that it would be any employer subject to those regs.
So, Mr. Chairman?
Yes, Lisa?
I do not know the answer off the top of my head, but I do know that there's a definition of employer within the Department of Labor section. So for tomorrow for committee, I can prepare a line amendment that just pulls in that existing code definition.
Okay. Is there a motion then that we entertain that amendment as part of this?
So moved.
Motion properly supported. All those in favor say aye. 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 Any opposed? Okay. All right. That amendment is attached. The financial contingency.
Mr. Chair.
Yes, Senator Vogel.
This is Senator Vogel. I apologize that I cannot be with you in person, and it's awkward to ask questions via Zoom, but I just have a couple questions.
Go right ahead.
As it stands now, we are already reporting to the health department, employers are, instances of COVID. And as I understand this, just to be clear, we are now asking VDH to build a website, spend time and resources doing that. And I just wonder if our resources and our time and effort is not better spent getting vaccines out and spending our efforts perhaps in a more constructive way. And I say this for two reasons. One, because I am concerned that it's already an issue for businesses to have a stigma when they have a COVID outbreak. And I am very sympathetic to what happened in the patron's district and a poultry plant. And with that, I am very sensitive, and he makes a compelling case. But I'm concerned about, one, this is already out there. If VDH wants to publicize it, they certainly can. But having to have people be posted on a website, it's not clear how long that stays. Like after the COVID instances or incidents are over and the people have recovered, how long does it remain there? I just feel like that in a way, it's not a very productive way to address COVID in businesses. And I'm wondering if anybody wants to address any of that, whether the patron or somebody on the committee staff or anybody would like to speak to that, because that actually really bothers me.
Sure. I'll take a whack at it first, Senator Vogel. And I understand your concerns. And of course, as with most policy decisions, this is a balancing act between competing policy perspectives and interests. I would say that I don't think they have to, just as a housekeeping measure, I don't think they have to actually construct a work site, because I think we'd have a higher fiscal impact if they had to construct a website for this. I think also the bill does have a provision in there as to when an obligation that sort of an all clear be sounded when the outbreak has eased, and there is a reporting requirement under the regs to the Department of Health with much lower standards than is embodied in this bill. This bill has many more guide rails as to when reporting is initiated, and you know, with a real linkage requirement. I believe it says more likely than not, or likely epidemiological linkage and along with, fits with the likely timing of exposure. So there's a lot of likelies in there. And that is modeled on actually a legislation in North Carolina, as I understand it. So again, understand your concerns, but again, I think the real competing interest is, as I observed firsthand, is to get, at some point, you have to get that information out to the public, in particular to the employees, that there is a significant problem going on with the disease that at those early stages little was known about and had some significant adverse health ramifications in the district.
Okay. Senator Vogel, do you have a follow-up on that?
Well, I would just say, Mr. Chair, if I may, I just put myself in the position of a lot of businesses in the community that I represent. They're already pretty worked up. And I just consider this is an additional issue for them. And I can imagine that they are going to be displeased with me if I support this, because they're just going to say, look, we're already dealing with COVID measures as responsibly as we possibly can. We're following the rules. We're reporting it when the instances occur of COVID. And I would imagine that they won't be pleased if they have to, if it has to be in a public website somewhere, because arguably it might be misconstrued as not just a COVID incident, but reflect badly on their business some way. And I just feel like that's going to get people upset. So I raise it for that reason.
Okay.
Thank you, Mr. Chair.
Other comments or questions from committee members? This, if we are to advance this, it will require a financial contingency clause. And I'm not exactly sure I understand why that much additional cost. I know you're talking about a person, but the seems like the information it is being required now, although yours is a little bit more specific in terms of reporting requirements.
Mr. Chairman, there is someone from the health department on the Zoom if you want to, Dr. Falana.
Yes, that would be good if we have if they could
Hi there.
respond to that.
Yes.
Yes,
I'm here. This is Lori Forlano. Can you hear me?
sure can.
Great. Super. Yeah, the fiscal impact described is related to essentially a human being. We would need an analyst that we would need to sift through all of the reports that are coming to us to determine whether or not the reports received through the Dolly VDH portal meet the stated definition in the bill as to which outbreaks have to be published. To date, we've received almost 20,000 reports through the Dolly VDH portal, so it definitely would take some staff time. So the fiscal impact is related to that data analyst.
Okay, thank you for that. Further questions? What's the pleasure? It would require the financial contingency amendment if we're going to report it.
Mr. Chairman, I would move the clause then.
Okay, is there a second? Okay, all those in favor of that amendment signify by saying aye.
Aye.
Any
Aye.
opposed? Okay. All right, what's your pleasure on the bill as amended?
Second.
Motion properly before us to report as amended. And I would say that I'm going to go ahead and support this. I do share some of Senator Vogel's concerns in terms of priority. So we'll have to look closely, in terms of whether or not that expense could be shaved or whether or not, we prioritize this to the level of funding that it might require. Okay, all those in favor signify by saying aye.
Aye.
Any opposed?
Senator McClellan votes yes by proxy.
Mr. Chair,
Yes, Senator Vogel.
with all due respect to the patron, and I understand the issue he's trying to address, I'm gonna vote no now, just because I do have some concerns, and I have questions. I guess we can discuss further maybe when we have other meetings with the finance subcommittee. But how you have 20,000 cases that or people that qualify who may have to appear on this website, it just does seem incredibly unwieldy to me.
Right.
So maybe there will be another opportunity for me to ask some of those questions. But thank you, Mr. Chair.
All right, thank you, Senator Vogel. Okay, with that, we do recommend reporting. Okay, thank you, Senator Lewis. Do we have anyone else in the room? Oh, we do.
Yes.
We have a distinguished visitor in the room.
Well, I've had to leave proxies all over the building. I left 2 proxies to give you.
All right, Senator Lucas, What you got here? Oh, you have Senate Bill 1333.
Okay, Mr. Chairman, good afternoon, and to the committee. Before you this afternoon is Senate Bill 1333, and this bill passed out of Education and Health and was referred to you based on the fiscal impact statement. This is a substitute, Mr. Chairman, so can I first move that we adopt the substitute?
Okay.
So moved. And Senator
Motion
McCollum
properly supported.
seconds.
All those in favor say aye.
Aye.
Okay, we recommend reporting that.
Thank you, Mr. Chairman. Since Thursday, we have been working with the Secretary of Health and Human Services and the Department of Health Professionals to fine-tune our language to make it crystal clear that the cost of this bill will be covered through fees charged to the licensee. With these amendments, the bill has no general fund impact. There are some technical changes that we made based on discussions with health professions. If you have any questions about those, I have Alexander McCauley from the Medical Cannabis Coalition in the Zoom room waiting. But Mr. Chairman, let me just give you a little bit of the other details.
Okay. And I believe this should be a fairly routine matter for us. I'm all on board with the medical use and the process that we've set up with the licensees around the state.
Yes.
I understand it can be a lucrative business, so I think they shouldn't have any problem paying the fees
Oh, absolutely not.
to accomplish this.
That's correct.
Okay, Alexander, are you there? Do you want to add anything?
No, Mr. Chairman, unless there are any questions. Then we certainly appreciate Senator Lucas bringing the bill, and we appreciate the department working with us to bring us technical concerns, which we think we've addressed. But I can go into as much detail as you want, or I'll just stop there.
Okay. Does any member have any questions?
Yeah, Mr. Chairman, could I ask the staff, Lisa, a question? The way the bill is postured now, is the fee adequate to cover the cost?
Yes. Alexander McCauley, he's there to answer that
Mr. Chairman, I would need to defer to Mr. Tweedy on the fiscal
Mike is
question.
here.
Okay.
Mr. Chairman, I believe that the substitute actually amends it such that it can generate the fee revenue necessary to cover the cost. We also have David Brown from the Director of Health Professions online if you need to ask him any specific questions about that.
Okay.
No, I'm going to move to report at the appropriate time. I just wanted to make sure that we're covered.
And I think that's what Senator Lucas had represented
Yes.
as embodied in the substitute. So,
That's correct.
I'm sorry.
Right, so that will, I don't think will be, unless the person online with that information would want to make a comment. If not, Chair is ready to entertain a motion.
Move to report.
Motion properly supported to recommend reporting Senate Bill 1333, amendment in the nature of a substitute. Any further discussion? Hearing none, all those in favor signify by saying aye. Any opposed? All right, we recommend reporting that unanimously, Senator
Thank you,
Lucas.
Mr. Chairman. This is the easiest bill I've had this year.
Okay, we're easy all the time when you got good ideas.
I love you. I'd like to come back to your life.
Senator Pillion?
Yes, sir. Yes, sir.
Thank you, Mr. Chairman. Senate Bill 1429 is Smith County Conveyance Bill. There is a substitute that I'd like to ask the committee to adopt, and I'll explain that.
Smith County, go.
The substitute.
Okay, motion properly supported to adopt the substitute for 1429. All those in favor say aye. Aye. Any opposed? All right, we have that in front of us now.
The substitute adds clarifying language that the state will not be responsible for any of the repairs to this building. It's been agreed upon by DBDHCS and Smith County. This bill authorizes the governor to lease a piece of property that's previously used by DBHCS at the Southwestern Virginia Mental Health Institute to Smith County for a term of 3 years. The building is currently been used for storage for a number of years now. This bill comes as a result of a group of local and state stakeholders working together to establish the Appalachian Center for Hope. It's a collaborative effort to provide recovery resources to those fighting the substance abuse disorders, Southwest Virginia. Senator Chafin, myself, Delegate O'Quinn, Delegate Campbell, as well as a lot of other locally elected officials had come together toward this building. During testimony, some of you may remember, if you're serving on the General Laws and Technology Committee, that John Graham from Marion testified to this bill and said that when Senator Chafin, before he left that day, told him to aim high. Well, last year we brought forward a $2 million budget request. We've become a little more realistic since then, and there is a $50,000 budget amendment associated with Appalachian Center for Hope that will hopefully help facilitate the transfer of the property and support startup costs. The healthcare network, the system that's in Southwest Virginia and East Tennessee, has agreed since that time to come on board as a partner, as well as a lot of other local stakeholders. This is the first step in getting that moving along.
Okay. I do recall this kind of bubbled up last year as we were talking about it. My first question, before I ask the other members for a question, is whether or not your substitute obligates the state to any of the financial.
No, sir. The substitute actually is taking the responsibility for any repairs away from the state.
Okay. Okay. That's a big question there. Any other questions or comments on this bill?
Is this the appropriate motion clause?
I don't think we need the clause here if the substitute actually removes the. It does.
Mr. Chairman, yes, the intent of the substitute is basically to say that Smith County or whoever will actually have the financial responsibility. So as it is now, it doesn't have a direct fiscal impact on the Commonwealth.
Okay.
So you would not need the clause.
Motion to report. Is there a second? Motion properly supported to recommend reporting the bill, that is Senate Bill 1429, amendment in nature of a substitute. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? Okay. Good work, Senator Pillion. Thank you, Mr. Chairman. Hopefully you can figure out something to do down in Hillsville. Okay.
Mr. Chairman, Senator Donovan is actually on the Zoom. Senator Suderline was on here, but seems to have dropped off.
Okay. Well, let's take Senator Donovan first then, since she's on the Zoom. Senator Donovan, you there?
Yes, sir, I am.
Okay. You have two bills on our docket. One that we listened to last week, and the issue there was you were trying to get more money into the auxiliary grant, and I believe the bill, as it's structured, we concluded that we were going to leave it on the table for a week, and I really believe we are not going to be able to pass the bill, but maybe we can continue your efforts within the budget itself. Is that where you're at, or do you have some revisions to it to offer?
No, Mr. Chairman, I agree with that assessment, and I would be happy for my bill to just be one more voice in favor of the efforts that are being made in the budget. And I appreciate your efforts on that. We all know what we need to do if we can find a way to do it. Okay.
With that, in deference to the patron, I would entertain a motion that we pass that bill by. So moved. Is there a second? That's Senate Bill 1185. SAC motion is properly supported. Any further discussion? Hearing none, all those in favor signify by saying aye. 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 Any opposed? Okay, thank you. We will pass that bill by, but we're going to have to work on improving the auxiliary grant. Senate Bill 1307, Senator Donovan.
Thank you, Mr. President. Senate Bill 1307, I could not be happier to tell you, actually decreases the cost for the state. So a little bit, it's the best fiscal impact I've ever gotten. But Mr. President, basically what this bill does is it changes the language of the state plan to allow localities to now bill the federal government for school-based services that are provided to children who do not have IEPs. Historically, the state has limited the way this works is it is through Medicaid. It is not through the MCOs. It is through a cost-based assessment where localities pay 100% of the cost of school-based services for the children in that local school district. And then they send that assessment, that cost-based assessment, to DMAS, who files that on to the federal government. The federal government gives the 50% they would usually pay for that kind of service, and that is passed through DMAS back to the localities. There is the option for us to, the federal government a few years ago, and thanks to Mike Tweedy, as always, for figuring out some of these great nuances, but the federal government made it possible for states to alter their state plan and allow local school divisions.
Whoop. Senator Donovan, we lost you.
Oh, I'm sorry. Am I back?
Yes, you're back.
Okay, sorry. So basically, this is all non-general funds, but it increases potential funds to localities over many years between $2.5 to $4 million. And it gives those local school divisions more money to provide services to kids so that they can overcome the obstacles to learning. The only fiscal impact that was directly relevant until we got the fiscal impact statement to the state was the funding for DMAS to put quality measures in place to look at these school-based services. We know that they need to be quality-based. We know that there are outcomes that we can seek to achieve for our children, and DMAS needs funding to do that, but they're able to build that in to the drawdown money from the federal government. And thus, even though they're expanding some of their staffing to accommodate this, it's actually a savings for the state.
Okay. Well, that is a good situation when you actually are making money rather than costing money and doing all that good at the same time. Any member have any questions or comments on this? Do we have anybody online that wants to speak to this? Mike, is that pretty accurate as Senator Donovan has explained it?
Yes, Mr. Chairman. So what this basically does is expand something that the state was already doing, which was basically through a cost-based methodology reimbursing localities who are providing services, mainly IEP services through have been covered in the past. The feds changed the rules a few years ago to actually expand it to allow you to cover services outside of the IEP, and that's really what this addresses. So what it does is it basically allows the local school divisions to bill for more funds. The reason why it has kind of a savings is because the state actually keeps about 5% of the money that we would otherwise draw down from the feds, and we actually deposit in the healthcare fund to support Medicaid. So essentially, we would actually recapture 5% of these additional funds, and that would be used to actually support any additional cost that DMS has for like a position, and it nets to a small general fund savings.
Okay.
Mr. Chairman, this does have other language changes, specifically about telemedicine in schools, allowing schools to charge for the telemedicine originating site fee so that we can begin to bring some services like mental health into the schools, but it doesn't affect the FISC either.
Okay, good. All right, any questions from the members of the committee? Hearing none, what's the pleasure of the committee?
Move to report.
Motion, is there a second? Motion properly supported to recommend reporting the bill. That is Senate Bill 1307. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Any opposed? Okay, we will recommend reporting that. Thank you, Senator Donovan. That's a good initiative.
Thank you, Mr. Chairman, members of the committee. Good evening.
Good evening. It actually made me think of an issue that we have with the Commonwealth Center, which is not directly related to it. It just made me think about it in terms of the way our students are classified there in the treatment that was disqualified from Medicaid. Do we have something in the works, Mike, to fix that? Do you know? I know the Commissioner Land was going to propose something where we needed to make some changes there. You know what I'm talking about?
Not exactly, but I can follow up and figure.
Okay, because there was an issue billing through DMAS for Medicaid there at the Commonwealth Center.
Oh, right. You're talking about the accreditation issue.
Right.
Yes.
Mm-hmm.
Yeah, and the agency is working There's supposedly by this summer, it will be reaccredited so that they can then bill Medicaid again. But in the meantime, they're using their special funds to cover the loss of Medicaid
Okay.
revenue.
But it was the way they were accredited, right? I mean, they were accredited, but not in a way
Correct.
for
Not
this-
the exact
the type
way
of
to
billing they
receive.
were doing.
Correct. Not the way that you needed to be accredited for
Okay,
Medicaid
okay.
reimbursement.
Not directly related, but it made me think of that with the special education there. All right. All right, we've got Senator Suderline, are you out there? All right.
Mr. Chairman, it shows that he isn't, here he is.
Hello.
Oh, Senator Suderline.
Hello, Mr. Chairman.
Yes, we see you now. You're here. As you're aware, you have your bill, Senate Bill 1133, which was not in direct conflict with Senator Mason's bill, but I think where we were headed, it appeared from last week, is that we were basically, I think it was a consensus, and I'll leave that to the committee, but yours was going to establish a pilot program, which you've been very consistent about for Roanoke County in terms of, and your wish this year was to go ahead with a pilot program rather than waiting on this study that we're doing. Is that correct? You want to speak to that further?
That is correct.
Okay. And that's basically it. And as of last week, and I don't know whether the committee has changed on that when I was basically looking for consensus, it was basically a consensus to not do this particular one, but go in favor of Senator Mason's bill. You want to add anything to it as far as why you would want to push ahead rather than waiting at least a year?
Well, Mr. Chairman, you've seen this proposal from me regarding the pilot for several years because Roanoke County would like to do this as would other jurisdictions. And it's kind of like the Brooklyn Dodgers wait till next year. And, hoping this year was 1955, but if that's not the pleasure of the committee, I understand it.
Right. Well, I think,
But I mean, it's the sort of thing where, we were told before that we couldn't do the pilot because of the JLARC report, which has now come back.
right. And I think your points are valid, and there's a constituency and a lot of advocacy, and I've been hearing that over the last couple of weeks, that are trying to encourage us to go forward with your pilot, because we've had this issue in several of the localities where they want to do that, including Stafford, Roanoke, and a couple of others. But you're queued up now, I think, in terms of getting there. So it shouldn't be that much longer, I believe, until we will have not only pilot programs, but we're going to be evaluating seriously that transition to a different way of providing those services through the local school divisions. At least that's what our trajectory is at this moment. Okay. Is there any member have any comments or questions or thinking to the contrary? Okay. Hearing none, the chair would entertain a motion.
Move that we pass the bill by indefinitely.
Okay. There's a motion. Is there a second? Second. Motion properly supported that the bill, that is Senate Bill 1133, be passed by indefinitely. All those in favor signify by saying aye. Any
Aye.
opposed? Any opposed? Okay, that bill then is passed by. And thank you, Senator Suderline, for your continued advocacy. We're heading in your direction, I believe.
All right, thank you.
Okay, let's see. Barker, and I have one. Okay. Mine should be fairly simple. Colin, you want to share briefly while I explain my bill? My bill is Senate Bill 1436, which would establish a healthcare provider reserve directory, and essentially what we're talking about is creating a database within the Department of Health where individuals that are qualified to provide services or could provide services in a medical emergency situation like we're in now, we would know who they are, where they are, that type of thing, and that information would be gathered. And the fiscal impact on that was modest, I believe. If I can find it here. Okay. $36,000, which they say can be absorbed and then continue in the first year, then $9,000 later. This was generated with a staff member in my office that had the concept, working with a member from Legislative Services, and they worked on this. It was amended in the Committee in Education and Health to create a situation where there would I forget the name of I knew it when I presented it last week. It's the family personal security, where you're not allowed to divulge information for certain individuals that are in education for fourth year. FERPA. That's it, right, FERPA, right. And it was amended there. The one question that came up before it was reported had to do with whether or not there was an opt-out provision if somebody didn't want to be in the database. And I thought that was appropriate, but we didn't draft that amendment. You didn't touch that, did you, Mike?
Does FERPA apply to higher education as well as K through 12?
Yes.
It does? Okay.
Yes.
Thank you, sir.
Yeah, but no one has pushed me to do this, but I think Senator Howe asked a question about whether it was voluntary. Actually, the information would be gathered just based on public information that's available, assembled in a database. But it would seem like if somebody wanted their name not to be listed, that there perhaps should be an opt-out provision. Do y'all think that would be appropriate?
Senator Evans?
Madam Chair, I would move that we have an opt-out provision amendment added.
Is there a second?
I would second that, I suppose.
Well, we got to vote on it first.
Okay.
All right, you've heard. All in favor?
Aye.
Aye.
Opposed?
Lisa, or Mike, is that something you can coordinate with Lisa to make sure we have that drawn in?
Yes, sir. I'll send you I'll get it done tonight.
Okay, thank you. Appreciate that.
Madam Chair?
Senator Evans?
It says the fiscal impact can be absorbed, so I would move that we report it as amended.
Before we do that, is there anybody signed up to testify? Okay, is there a second?
Second.
It's been properly moved and seconded. All in favor, say aye. Aye.
Aye.
Opposed? Back to you, Mr. Chair.
Okay, thank you, Senator McClellan. And all right, that bill will recommend to be reported as amended. Senator Barker's bill is definitely going to need the clause, and I'm not sure what else he wants to do with it. Mike, do you know what we need to do there?
Mr. Chairman, I told him I could describe it to you all, and then of course, he can make a recommendation accordingly. And certainly he can talk about it in the full committee.
I think
these bills will be heard at the Wednesday meeting.
Okay.
So we can certainly talk to him in between now and then. But essentially, and you may recall last year there were also remote patient monitoring bills. So what this one essentially does is it would add remote patient monitoring services under Medicaid. If you have it in front of you, but I'll describe it. It adds it for basically, and this of course is provided through telemedicine. It adds it for high-risk pregnant persons, medically complex infants and children, transplant patients, patients who have undergone surgery for up to 3 months following the date of the surgery, and patients with chronic health conditions who have had 2 or more hospitalizations or ED visits related to such chronic health conditions in the previous 12 months, and then patients at risk for hospitalization. Last year, this was a little bit, the fiscal impact was closer to $2 million. As you can see, his fiscal impact is closer to $6 million general fund this year. That is mainly because of the sixth provision of patients at risk of hospitalization. So I don't know if Senator Burke would be interested in reducing the cost some. If you took that part out, it would drop it to just under $2 million in general funds, is my understanding. But I'm not exactly, I haven't discussed it with him, so I don't know what his choice would be. But that is an option
Okay. Do we have anyone online that wants to speak to this right now? Obviously, this one, I believe, I'm strongly supportive of telemedicine services. However, there is a significant cost involved, so it's going to have to be evaluated in terms of priorities for initiatives this year if we're going to do something like this, so it would require the clause.
Mr. Chairman, I would move that we add the clause. Second.
Motion properly supported to add the financial contingency clause. All those in favor signify by saying aye. 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 Any opposed? Okay, any thoughts the committee members have on the bill itself?
Seems like a good idea. Second.
Motion properly supported that we recommend reporting this bill favorably, subject to the financial contingency clause. Further discussion? Hearing none, all those in favor of that motion signify by saying aye. Aye. Any opposed? Okay. I believe, Mike, that clears our docket as far as the bills?
Yes, Mr. Chairman, it's clear.
Okay. Any member have any further comments to make before we close out the meeting? Okay. Lisa, did you get everything you needed from our action?
Yes, sir. Thank you.
Thank you, and I understand, hopefully you might work late tonight. Mike tells me we're going to schedule these for Wednesday rather than tomorrow. Is that correct? Or will some of them come up tomorrow?
No, Mr. Chairman, all these bills will be in a HHR subcommittee report at the Wednesday meeting.
At the Wednesday meeting, okay, good,
Oh,
good.
that makes me even happier.
Is when, Mike, is Wednesday the last full committee meeting?
For finance and appropriations, no, I believe there will be a Thursday afternoon meeting.
Oh, joy.
Which we always hold in reserve in case they're late referrals, which I believe there are some coming.
Okay.
All right, thanks.
All right. Any other discussion?
Mr. Chair, will we have to advance the readings, I guess, so they can pass by crossover? Do they need to do that?
Anything that comes out at the Thursday meeting, we will have to, yeah.
Okay.
Yeah. Okay.
You know what time that is?
Should be 4:30, as we normally would do that, isn't it?
Yeah, I don't know for sure, but I'll double check. It usually is late in the afternoon, 4:30.
Okay. All right. If there's no further business to come before the subcommittee this afternoon, I will declare the meeting adjourned.